Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Good morning. I'm Dr. Jennifer Klemp, the co-leader of the Cancer Prevention and Survivorship Program at the University of Kansas Cancer Center. And today I'm sitting in for Dr. Roy Jensen. But with me is Dr. Jamie Myers, who's a Cancer Center member, and she's an associate professor in the KU School of Nursing. And I feel lucky that I've had the opportunity to work with you for so many years. Thank you for being here today, Jamie.
My pleasure. I'm enjoying getting to talk with you and talk about an important subject.
Absolutely. So today we're going to be talking about something that affects a majority of cancer patients, which is called chemo brain, cognitive dysfunction. There's lots of words going around, but can you kind of give us some explanation and background about chemo brain?
Absolutely. So chemo brain is sort of the common terminology that people are using to talk about cognitive changes that people experience after a cancer diagnosis and after treatment for a cancer diagnosis. It's really not limited to just chemo brain per se, but it's kind of what's been the most popular term in the lay public. But what it actually means is people will have concerns about short-term memory, about the ability to multitask like they could before their cancer diagnosis. Word finding is a particular concern that's mentioned a lot when I've been talking with people who are going through this experience. And fairly common, as you mentioned, up to say 75% of people will experience this sometime during their treatment for their cancer. And then there appears to be a subset of people, more like 30%, that would have longer term effects.
And are there things potentially, like your area of research, that you focus on based on some of those risk factors or based on some of the symptoms that patients are experiencing?
Well, our research is fairly broad. We've gone several different directions, but we have looked at what might be some predictors that would make people at higher risk for quote-unquote chemo brain. And there are many, many risk factors, one of which is age, because as we age, we know cognition can change over time.
And let me ask you a quick question there. Is sometimes it hard because there's a natural aging process that's happening, and then there's things that could be impacted by cancer and the treatment of cancer. Are they synergistic, or could it maybe even accelerate that cognitive change?
That's one of the most popular hypotheses currently, is that there's an accelerated cognitive aging process going on. As your body mounts out an immune response to the cancer as well as the treatment, some products get secreted into the bloodstream and into the fluid around the brain that can make it harder to have concentration and memory and focus.
And what are the other types of areas that you're focusing on in your research?
Okay, so besides just describing the phenomenon and making sure people are aware of it and we're educating people about it, we've looked at ways to help people cope with these types of symptoms and side effects. So a couple of studies going on. One which we've done in collaboration with Cedars-Sinai, or the Osher Cancer Center out in LA, because we're all part of the SWOG Cancer Research Network. We did a pilot between our two institutions looking at a 6-week program that's cognitive rehabilitation, which basically means we're providing participants with a toolbox of strategies that they can try and practice to help minimize the cognitive effects of cancer and cancer therapy. So we talk about things like exercise, which we can spend some more time on. I know that's an area you're interested in too. Nutrition, how to make sleep more effective, mindfulness, and social engagement are just some of the things that are part of that program, as are exercises to practice and hone memory and the ability to remember people's names and the words that you're trying to find. There's some practice strategies that are part of that content that people have found really helpful. So
what kind of responses do you get from the participants?
Interestingly, very positive responses. And we've measured people's self-report or perception of their cognitive function pre and post this intervention, and found that the people that were taking part in the intervention did have significant improvement. So hopefully, with funding that we're seeking right now, we'd like to take that to the next step. And instead of broadcasting that program live between LA and Kansas City or Topeka or some of the other parts of the Midwest Cancer Alliance that we're participating in that study, we'd like to make it in a pre-recorded format so that we could offer it more broadly nationally, and people would have access at the time that was convenient for them.
And SWOG is a research network across the country that would really offer community academic practices and really patients all across the country the opportunity to have access to such a novel intervention, and really focusing on that rehab model, which we know works for cardiac, and we have other types of cancer rehab. But I love the fact that you're couching sort of the cognitive performance under that as well, because it makes perfect sense.
Great.
Great. So let's take a minute right here. We have Dr. Jamie Myers with us, who's talking about Chemo Brain and the research that she's undertaking with a great team here and across the country. And Cameron, do we have any questions that have come across Facebook Live or across any of your social media outlets?
We do not have any questions at the moment, but if you have any questions you would like to ask our experts, please place them in the comment box below.
Great. So that's an opening for all of you out there. Please share your questions or thoughts with us, as we have an expert here. And I think it's really a fun topic, because what you've highlighted are some opportunities for patients who are struggling with Chemo Brain. So can you tell us a little more? You mentioned the cognitive rehab. What are some other areas of research that folks may be interested in?
Okay, well, one other study that's going on right now is actually one that's being run through the School of Nursing. Our dean, Sally Maliski, has a study open now for people that are being treated for prostate cancer, specifically having testosterone suppressed as a component of that therapy. And we are aware that that also can cause some of these same types of situations that people have when they receive chemotherapy, so trouble with memory or concentration. And she developed an intervention that combines exercise, both aerobic and resistance band training, along with nutrition and nutritional coaching, and specific ongoing conversations with nursing staff to minimize some of the cardiovascular things that can happen with androgen deprivation therapy. But interestingly, thanks to her collaborative spirit, we've also added a cognitive endpoint to that study, and will be and are measuring not just self-report of cognitive function, but also people's performance on neurocognitive tests before and after they've been through this program. We assess them at baseline, again at 6 months, and then again at 12 months. And we're just about ready to analyze the 6-month data. So I'm hoping that we'll have some good news to report.
Well, and you brought up a point about assessment. Are there new things that you're working on in regards to assessment of cognitive function?
I'm so glad you asked that. So I've been really fortunate to partner with the School of Health Professions as well. And they have a lab that's called the LARS, or the Laboratory for Advanced Rehabilitation Research and Simulation.
It's a mouthful.
I know, it's a mouthful. But they have access to equipment that allows us to assess people's pupil dilation. And as it turns out, there's a disconnect between people's experience of Chemo Brain and how they perform on these cognitive tests that we have available to us. And we're searching for a more sensitive, more accurate way to assess what's happening there. And pupillary response is really a good indicator of cognitive effort. In other words, I'm performing really well on this test, but I'm working really hard to do it. And by scanning people's pupils, we're able to measure that. And we're have had some exciting things going on that have been funded by the Frontiers and by the KU Cancer Center.
That's wonderful.
Yeah.
And what type of test are they doing? Are you giving them words? Are they doing some sort of activity? Tell me a little bit about that.
So we try to keep the testing somewhat abbreviated, so it's not too burdensome for people, but there are lists of words that they're asked to repeat back over time. There are paragraphs that we give them at the beginning of the test and have them talk to us about what they remember, and then we do that again later in the examination. But lately we've added something really unique, which also is through the School of Health Professions, and that's a driving simulation. That's actually can be done portably in any setting, and it allows us to assess processing speed and visual spatial ability, and then we add a little bit more burden by having them do a memory test while they're doing the driving simulation, and we're looking at their pupils to see how much effort they're expending while they're doing that.
So you're really pulling in that real world experience where we're doing things with distractions and nothing's done in isolation.
Exactly.
So that real world experience takes us to Cam, who I think has a few questions for us.
Yes, we do. We do have a few questions. The first question is, how can the medical oncologist track the Chemo Brain before the symptoms begin?
How can a medical oncologist track the Chemo Brain before the symptoms begin?
So maybe how should the medical oncologist assess even pre-treatment so they have a baseline for that patient?
Okay, well there's several options for that. If you wanted to really get fancy, you would do a neuropsychological exam at baseline and then one, midway through treatment. That's not always practical for people. So there are actually some pretty simple tools that I like to use, which are self-report.
Right.
And there's a system called PROMIS, Patient Reported Outcomes Measurement Information System, that's just like an 8-item instrument that a participant or a person newly diagnosed with cancer could fill out, in addition to their own self-report, which is, I think, probably the most valuable thing we can ask, because it's their experience. They know where they're starting, they know what they've lost, and that's really, in my mind, a valuable way to assess it.
Absolutely, and as we've worked together, I feel like one of the most important questions we asked was just basically just what you said. How has your performance changed, and what are the things you've noticed? Right. The hard part is a lot of people aren't asking that at the beginning. Right. So really bringing that back to empowering the patient to say, you know what, this is important. And so many people, regardless if they have a high demand job or a moderate or they're retired, these are very important quality of life issues that I think sometimes we don't pull back into the clinic. So really important for patients to think about.
Well, and I think you highlighted something important there, and that is something that I've been trying to advocate for the last several years, and that is that we educate people about this as a potential side effect up front.
Right.
Because I think what's really scary for people is if they haven't been taught that this is something that could happen and it begins to happen to them, it can be very scary, because they're thinking, what's going on?
Right.
And this is a way to validate the experience and kind of prepare
and
people
at the
for
whole
it.
person. Right.
Yeah.
Kim, do you have another question for us?
We do have a second question. The second question is, now that some of us are a few years out with treatment and have been released back to our family physicians, how can we help make them understand what we may need to look in regards to our current healthcare needs, and how prescribing any vitamins or any other things that they can help us decrease the effects of Chemo Brain?
So kind of what are the good strategies that you would recommend, whether it's primary care or oncology? That you mentioned sleep and exercise, but what are the other types of things that folks could be doing?
Well, I think raising awareness is key. And the mechanism for us to do that, I think, like this that we're doing right now, is good. It helps raise awareness. There's also, I think we're going to show at the end of our session, a little link to American Cancer Society has some information on what Chemo Brain is and kind of, what we know today. Right. So that's one thing that can be shared with a primary care physician as a way to help educate them. But I would like to highlight exercise, though, just for a minute, because the evidence is really building in a very positive way that exercise might be one of the best things that we can do to help mitigate the impact of Chemo Brain, because it helps decrease those products of inflammation that I mentioned at the beginning. It helps reduce fatigue, which can complicate Chemo Brain. It helps improve people's sleep, which also sleep deprivation, as we were talking about earlier, for those of us who have young children, can be a problem with mental clarity and mental function. And so if people can find a way to build even just a moderate, regular exercise into their pattern, their daily lives, something that's sustainable for them, I think that's a really positive thing that they can try.
So you've kind of highlighted awareness. We need to get sleeping better, we need to get moving. So it's sort of a stepwise process, but overall, these are healthy behaviors that we should be practicing kind of anyway. So overlaps with a lot of other positive health behaviors that we recommend. So these are good practical strategies.
We haven't talked about nutrition yet, and the evidence is still, being looked at for this, but there are some recommendations of food that can help decrease products of inflammation as well. And you probably are well aware of omega-3 fatty acids, and the importance of having a balance of that in our diet, as opposed to, say, omega-6 fatty acids, which would be more fried foods and foods that are high in fat. So people can consider adding things like fatty fish to their diet, salmon or halibut or avocado or Brussels sprouts, or that sort of thing.
All sounds tasty.
There you go. We're going to be hungry when we're done. But keeping their diet in balance could also be of benefit.
Great. And I think Cam has a couple more questions for us.
Yes, we do.
Great.
We do have 2 more questions for you. The first question is it recommended to have chemo drug or chemotherapy if it caused Chemo Brain? Does chemotherapy cause Chemo Brain?
So I think we'll narrow that down to, is it the chemotherapy that causes the Chemo Brain, or potentially some of these a multitude of factors?
It is definitely a multitude of factors. The cancer itself, the body's immune response to the cancer itself can cause some of these cognitive changes. There's a percentage of people that will have expressed changes in cognitive function before they ever receive their treatment. And that's compounded by adding chemotherapy to that because the body's responding to toxic substances, which are fighting the cancer. Can be further complicated by some of the other treatments that we give, such as suppressing estrogen for breast cancer or suppressing testosterone for prostate cancer. Radiation therapy, because it enhances people's fatigue, can layer on of that process that's already started. So that, in addition to maybe going through menopause more quickly than one would have normally because of chemotherapy or because of surgery, and aging, as I mentioned, it's very multifactorial.
And that multifactorial situation makes it kind of like you're peeling back the onion. So the hard part is you're going to have to try different strategies to really see what works. But you did highlight a key word called prevention that we don't do a lot of with Chemo Brain in particular. And I think getting folks into some sort of exercise as early as possible, addressing sleep, addressing depression, all those things that already have a side effect of sort of decreasing our overall cognitive performance could be really good strategies to our medical professionals out there as part of not only good just overall behaviors for our cancer patients, but could help alleviate some of these symptoms that they may experience.
It'd be a good best practice.
There you go. Yeah. Kim, I think you have one more question for us.
Yes, we do. We do have another question. The question is, how can family members help patients cope with Chemo Brain? Has your research discovered any additional tools caregivers can provide?
I really like that question. Thank you to whoever asked that. Cancer affects the whole family, absolutely. And the more understanding friends and family can be about the things that the person with the cancer is going through, the better. And for family to be aware that maybe the person's short-term memory is having some issues and that maybe they are going to repeat themselves several times about something that they have already told you, and being sensitive to that and tolerant to that and accepting of that goes a long way. Helping people if there's important things that you know they want to remember, like they've got an appointment coming up that they want to be sure to get to on time, and there's things that they need to do to get ready for that. Just being supportive and trying to help give them the reminders that they need to make sure they can accomplish that. I would love to see the whole family get involved.
I think as someone who's been a caregiver, one of the most fun things I used to do for my mom was to put sticky notes on the door or her steering wheel if there was something she needed to remember. She still uses that technique today, but just basic things that help you remember and actually help kind of all of us. So it's a system change that we can do at home and make that person feel supported. So I think
reminds me of one other thing. While the family's in there being supportive, to the person themselves, I think give yourself permission not to be perfect. Things have changed in your life. A lot of really important things have happened that have changed things significantly for you, and if you're not able to multitask 3 different projects at the same time like you used to, forgive yourself for that.
So it's okay just to do one thing at a time.
Probably best.
We're just so hardwired now to be like overproductive. So.
Exactly.
Good. And Kim, any other questions for us today?
Yes, we have one more.
Great.
The question is there a time frame when Chemo Brain occurs? Does it occur at the beginning of treatment, or could it occur after you have finished chemo?
Another really good question. We're going to have to pay the people out there for asking such good questions. There's actually really a bell curve. Some people will notice the changes in their cognition right away, like right at the beginning of treatment. Other people, it's more common to notice, about midway through. And then for a group of people, it's really not until treatment's done and the dust settles and they're kind of getting back to their regular patterns without all those doctor's appointments and everything, that they say, something's different. So it's very individualized, and so is how long it lasts. And that's something actually we're still researching, is why does it last longer for some people than it does for others? Maybe it's a genetic situation that puts some people more at risk than others. Maybe it's those other health patterns that we talked about, or a combination of all of the above. But very individualized in terms of when.
And you're kind of trying to hone in on some of those risk factors so that we can better understand who will get it and who possibly would have lingering effects of it, and then what do we do about it?
Exactly.
Yeah, great.
Exactly.
I think Cam mentioned we actually have another question. Yes, we
do.
appreciate these. These are all some of the best questions that could be asked, so we appreciate them.
The question is, can Chemo Brain situation be reversed or cured?
Can it be reversed or cured? we're still working on that. What is the best thing to either make this go away when it happens or prevent it from happening in the first place, which is where I'd really like the research to go ultimately. The majority of people get pretty close back to baseline. There's just this subset of maybe 25 to 30% of people that are going to have more long-lasting effects, and we really don't know why yet. So to be continued as the research continues when we can answer that question.
But I think what you've brought up too is just because maybe someone doesn't ask you about it doesn't mean you shouldn't share that this is an issue. Absolutely. I know we've had patients in the past where it's really compromised their ability to function or their perceived ability to function at work. So if this is an issue that's affecting any of our folks listening or your friends or loved ones, make sure that you're empowering them to talk to their care team because we do have some strategies. We want to help and intervene, but we have to know about it. So
that's a great point.
If no one asked you, make sure that you're going ahead and offering that information up.
Excellent point.
Great. Well, any other questions, Cam?
No questions at the moment.
All right. Well, thank you all for those very insightful questions. And we also want to thank Dr. Myers for coming and spending, it feels like such a short period of time, but we've learned so much on Chemo Brain. And obviously she also highlighted some resources. One is you could visit cancer.org, which is the American Cancer Society's website. And we'll include that link and some additional communications below. As always, we invite you to join us every Wednesday at 10 a.m. for Bench to Bedside. Thank you for watching, and thank you again, Dr. Myers.
My pleasure.